Hello and welcome. I'm your host, Neal Howard. Thank you so much for joining us. Our guest in studio today is Dr. Glenn Rich, endocrinologist, recently certified as a diplomat by the American Board of Obesity Medicine. Now, this designation represents the highest level of achievement in the medical specialty of obesity medicine. Dr. Rich has established the Weight Control Center at Fairfield County Medical Group. The center takes a multidisciplinary approach to managing patients with obesity while providing evidence-based, compassionate care. Welcome to Health Professional Radio, Dr. Rich.
Thank you.
Thank you. In a couple of years ago, I believe the American Medical Association recognized obesity as a disease affecting 33% of the population of the United States. Now, you are a board-certified specialist in obesity medicine. What was it that drew you to obesity medicine?
It changed during my journey. I was been an endocrinologist for about 25 years and an internist for 25 years. And one of my biggest frustrations practicing medicine was seeing patients who are overweight, knowing that in a couple of years they were going to become diabetics or other complications from weight-related illnesses, and just recommending diet and exercising and realizing that it was not working. And I could predict the patient would be diabetic in 2 or 3 years, and even though the patients were well-meant and really tried to do what I recommended, what I had to offer them was inadequate, and they would develop diabetes in a couple of years, so I wanted to go back and learn something new that I could be able to help my patients with.
In seeing some of these patients doing what you were recommending that they do, and they were still developing these problems associated with being overweight, weren't you offering what you were taught to offer them in med school and in research and whatnot? How was it that you had to dig deeper in order to be more effective?
In medical school, at least when I trained 25 years ago, we had very little training in weight management.
Okay.
And most of our training was just for recommending healthy diets. And actually many of the diets until a few years ago were really diets that recommended low fat and more high carbohydrates. And in retrospect, that really seems to have been the wrong diet for weight management. So even as an endocrinologist, I don't believe my training was adequate to really address this much more specialized area right now. And also over the last 5 or 10 years, there's been a lot of new information about obesity and our understanding that it is a disease and not just a life choice. And there's physiological and biological factors in the individual that makes it very challenging for them to lose weight.
Now, let's talk about the center there in Fairfield County. When did this get started? When was it founded? The Weight Control Center.
This is a multi-specialty group, and when I became board certified, I hired a couple of nutritionists to work with me. I have a diabetic educator who works with me, and I sort of reached out to the community for some of the other stuff that I'm unable to offer here, in terms of exercise, in terms of counseling if I need that. So I've done what I can do in a small private practice in terms of making it a center for the patients right here. And then it's stuff that I can't offer in my office. I have offered it by getting outside sources to send the patients to.
Does your specialty in obesity medicine lend any advantage to the person who is not obese or has not been genetically identified as a potential obese patient? Can some of these people who are not even identified as going to be obese, can some of these practices help them to not become obese? Because just because you're not identified genetically doesn't mean that lifestyle won't cause you to become obese.
Yeah, and I think our lifestyle in the last 20 to 30 years really has driven the obesity epidemic. And in the last number of years, you could see the rise in obesity, and now it's considered about a third of the population is obese and a third of the population is overweight. And clearly our environment and our society has geared people, has sort of made it more difficult for people to stay healthy and with a healthy lifestyle. All the stresses, all the lack of sleep, and other factors. So any person who was at risk for that or was starting to gain weight, I think some healthy lifestyle choices working with a physician is always helpful, and working with a weight sensor, if they're starting to gain weight, I think would be helpful for many of the patients.
Has the mindset about obesity, as far as from the standpoint of physicians as well as the patient, has that mindset shifted in a more positive direction, more conducive to effective treatment, or are you still battling the mental aspect of being an obese person when someone comes to your center?
I think there still is a very large amount of weight-related biases in this country, and I think there's also a huge amount of guilt in patients who are overweight in terms of blaming themselves for why they're overweight. So I think one of my roles is to try to get away the stigma of weight from the patients, try to talk with them and explain to them that there are many factors that they don't control that causes weight gain. And things from genetics to changes in the brain hypothalamus to other factors in their life that makes them prone to gaining weight. And I think this trying to take the guilt off the patient and tell them they have a disease. You wouldn't blame a patient who had a cancer that they were the cause of it. You wouldn't blame a patient with diabetes that they're the cause of it, or high blood pressure. And I think a lot of people with weight-related illness have been blamed for generations that if they just stop eating and exercise, that it's all their own doing. And the science does not support that. The science supports that this is a disease like any other disease with causes and effects. And so I think taking that guilt away from people and having them understand that there are factors that we can work with to try to help them is very important.
We see an attempt in advertising in mainstream media to accept being overweight as just a normal part. There's some people are overweight, some are not. Commercials are becoming very accepting of what they call plus-sized models and actresses and actors and whatnot. Do you find that is either a non-issue, or is it something that you see some of your patients saying, you know what, maybe I should just not try and work as hard at this since this is just the way that I am, and you as their physician can see that maybe acceptance is not the way to go at all?
I think there is more acceptance these days in weight in some individuals. I think it's very personal. But I still think even though there's acceptance, there's still a lot of biases in there in terms of employee biases. And even when there's some studies looking at physicians' biases with patients and how they perceive them, there's actually a lot of biases in terms of weight management with those patients also. But what I try to instill with the patient, most patients, even though they may be more accepted by society, it still has many effects on their life in terms of health that is very important. I sort of consider it as an unhealthy BMI, an unhealthy weight when I talk to the patients, because it leads to so many different diseases and so many life complications that even if it was socially accepted medically, I think there are a lot of ramifications for many patients who are overweight or obese.
Now, and where can our listeners get more information about the Fairfield County Medical Center and the Weight Control Center at Fairfield County Medical Group?
Actually, right now we're in the process of redoing our website, but it should be up and running hopefully within a couple of weeks. And our website will be www.fairfieldcountymedical.com. And we're in the process of redoing that to include the obesity stuff in there. But hopefully that'll be up in about 2 or 3 weeks.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Glenn Rich, board-certified endocrinologist and board-certified as a diplomat by the American Board of Obesity Medicine, a designation that represents the absolute highest level of achievement in the medical specialty of obesity medicine. And Dr. Rich has been in here in studio with us talking about his multidisciplinary approach to managing patients with obesity while still providing evidence-based, compassionate, and considerate care. It's been a pleasure talking with you, Dr. Rich.
Thank you.
Thank you.
It's been a pleasure talking to you also, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.